only older folks had to worry about, but that's just not the case anymore. These days, it's affecting young adults who are barely in their 20s. Now, let me read out some worrying trend and some instances. On May 2023, a 15-year-old dies of heart attack in Greater Noida. On June 2023, a 17-year-old dies of sudden heart attack in Kolkata school. On July 2023, a class 12 student collapses and dies of heart attack in Rajkot. On August 2023, a 16-year-old boy, just 16, died of suspected cardiac arrest in Telangana. And many more cases like this. Well, it all comes down to our fast-paced life induced with stress and lack of sleep. Being glued to screens and desk job is not doing our hearts any favors. But that's not all. Conditions like diabetes and hypertension are also playing a part behind this worrying trend. Our modern way of life has given us some advancement, but at what cost? We are talking about a lot of sitting around and not moving as much as we should. And when it comes to food, well, let's just say that there's an abundance of processed high-calorie options readily available, that we can just eat it up and pay more trouble to our hearts. And it's not just that about eating habits. Stress seems to be on the rise too. With our fast-paced life, it's no wonder we are feeling the pressure. So you see, it's a bit of a mixed bag. We have got all these amazing modern sciences, conveniences, and they've also come up with some very serious heart health consequences. That's why it's more than important to take a step back, reassess our lifestyle, and make some changes for the better. But the question remains, what can we do about it? Well, stick around, because on the show today, I'm joined by an esteemed panel of media professionals who are going to explore some ways that will help you keep your heart young and healthy. A very warm welcome to you. Today, I'm joined by Dr. Sanjeev Gera, Director and Head at Interventional Cardiology, Fortis Healthcare. Dr. Gaurav Minocha, Director and Unit Head at Interventional Cardiology at Max Healthcare. Dr. and Professor Sanjay Kumar, Director and HOD, Cardiologist at Fortis Healthcare. A very warm welcome to you. So before I get to you guys, there was this disturbing incident that I was reading about in Lucknow. A boy who was in 9th class, just 15-year-old, died of heart attack. And we have some reactions coming in from his parents and teachers. So first, let's listen into that and then we'll dive into the discussion.
आज हमारे विद्यालय में एक बहुत ही दुखद घटना घटित हुई। हमारे विद्यालय के कक्षा 9 का एक छात्र, जिसका नाम आतिफ सिद्दीकी है, आज केमिस्ट्री के पीरियड में अचानक बेहोश हो गया। इस छात्र के स्कूल के टीचर्स एवं नर्स द्वारा अपनी कार से तुरंत आरुषि मेडिकल सेंटर उनको भेजा गया। तब तक बच्चे के पिता को भी फ़ोन से जानकारी दे दी गई और वे भी आरुषि मेडिकल सेंटर पहुंच गए। वहां डॉक्टर के सीपीआर देने के बावजूद जब बच्चा होश में नहीं आया तो डॉक्टर ने बताया कि बच्चे को हार्ट अटैक हुआ है और उसे तुरंत लारी कार्डियोलॉजी हॉस्पिटल ले जाया जाए। मेडिकल सेंटर की एम्बुलेंस से टीचर एवं नर्स बच्चे को ऑक्सीजन सिलेंडर के साथ लारी हॉस्पिटल ले गए। लारी कार्डियोलॉजी के इमरजेंसी में पहुंचने पर डॉक्टरों ने बच्चे को मृत घोषित कर दिया। इस घटना से पूरा सीएमएस परिवार सदमे में है और शोक संतप्त है। हम इस कठिन समय में बच्चे के परिवार के साथ हैं और किसी भी जांच में पूरी तरह से सहयोग देने को तैयार हैं।
Well, that was one disheartening incident that happened, that we are talking about a boy who was just merely 15-year-old and they are suffering from cardiac arrest. So let me first come to you, Dr. Sanjay. My question to you would be that, in the recent years, we have been seeing that people are suffering from, and not people, heart attack. Earlier, we used to think about that is something that only older people would get, like people who are in their 50s, people who are in their 60s, or people who have, medical conditions like diabetes and hypertensions. But now we are seeing kids who are merely 15 years old, who are merely 14 years old, and they are experiencing heart attack. I mean, what is the reason? What is happening? What is the, core reason behind this worrying trend that we are seeing in the youth nowadays?
Ma'am, yes, heart attack, as we commonly say, is the coronary artery disease, is on the rise, and it's occurring at younger age groups. But if you're looking at cardiac arrest and heart attacks are two different things.
Okay.
And yes, for cardiac arrest, the leading cause still remains a heart attack. But in a younger age group, as I said, heart attacks are increasing in younger age groups, but in these particular incidences that you're saying, 15-year-old, 13 years, they I don't think they are heart attacks. They are cardiac arrest due to other diseases of the heart, like cardiomyopathies or channelopathies. The cardiac arrest can occur due to many other causes. Just as our health infrastructure has increased and people are able to reach setups, so they are now being diagnosed more frequently. So yes, heart attacks have increased and are occurring at younger age groups, but these cases may probably not be heart attacks. Yes, they are cardiac arrest, and probably a trained person on basic CPR could have revived these people. So they are more likely to have been cardiomyopathies or channelopathies that have caused these events like this one.
Yeah, so as you correctly pointed out that, cardiac arrest and heart attacks are two different things, but there is also lack of awareness about it. People usually don't know the difference, and for instance, let's say, Dr. Gaurav, let me come to you. We talk about heart attacks, we are talking about cardiac arrest, and even though, what is it that changed in the lifestyle? What is it that is because people of my generation, especially who are barely in their 20s, who are just starting, we are so conscious about the way we look. We go to gym, we are following these diets from keto to Mediterranean to, I don't know, I just can't even list out the names of the diets. But still, we are still suffering from, even I've seen cases and I've read about cases where people with no prior medical conditions are also suffering from, heart-related diseases. I mean, what is the solution, and is there a particular diet that needs to be followed, or is it being too much health conscious is also, triggering these heart diseases?
Well, two aspects. One is, heart disease happening in the early age group. Now, Indians as a community are more prone to heart disease. We are more prone than our Western counterparts, or maybe in South Asia. The risk of heart disease is as high as 2 to 5 times. So one is that. The other is that yes, our lifestyles have changed. Even though some of us may be more aware, but still many of us continue to have a stressful lifestyle. Smoking is a big risk factor, and since it is happening in the younger age group, we also have to look at their family histories. Sometimes the family history also indicates a risk in the family, which can be looked at, and these people can be sort of more conscious and more alert. Because of the social media revolution that we have, as Dr. Sanjay said, we are becoming more aware of these events, and sometimes it is causing a scare, which is probably detrimental, that people get stressed out more rather than taking it positively.
Yeah.
So as you said, you need to be conscious about a heart healthy behavior. You need to be exercising regularly. Don't overdo it. That is one part which can sometimes happen. That overindulging in exercise, undue exercise, sudden exertions can precipitate plaque ruptures in younger people who have some risk factors which they are not aware of. Now, not knowing about something is one thing, which can lead to an event if you overdo exercise. So it's important to know your numbers. People even at younger age group can have pre-diabetes, can have high cholesterol levels, and in case they start smoking, this builds up the inflammation in the heart arteries, which can then precipitate heart events. So I think it is you cannot. It has to be individualized. You as an individual need to know your risk and need to take action. We as a community need to have a good lifestyle, right? So you need to know your numbers. You need to be clear about your blood pressure number. Even if you are young, your sugar number, your cholesterol numbers. Do not smoke, and exercise regularly. I think that should be good enough to save your heart.
Well, definitely, the ways you mentioned that having what is, to keep our heart young and healthy, to have a proper diet, to have a life that is, choosing healthy life choices, making healthy life choices is very important. But, the kind of lifestyle that we are living nowadays, it's so induced with stress. Dr. Sanjay, let me come to you. When we talk about, making good health choices, but how is that possible? Like, how can one person make time for it? Because we are glued to our desk jobs, we are glued to our phone screens. And then we have, if I'm feeling lazy, I'll just go ahead and I'll just, pick up a frozen food, I'll fry it out and I'll just eat it. So, how important it is to manage that, cycle, to have that stress management in your life, to have that sleep management in your life, which sleep is a factor that I think gets overlooked a lot. So how do you think that in a busy lifestyle like that we are leading nowadays, how is it possible to keep that in your mind that, I have to take care of my heart, how to prioritize that?
So basically, as I agree with both the colleagues, if you talk about early heart disease or heart disease in young youth, basically presenting to us with heart attacks, so there are three important factors which I actually see in my patients. One is sedentary lifestyle, one is stress, and other is smoking. So smoking, as Dr. Gaurav rightly said, that we have to quit smoking. So two important things, like mental stress is very important, because whenever you have stress, there is increase in inflammation, there is increase in cortisol. These two markers actually, they thicken your blood in terms of a layman language. It thickens your blood. That causes more of clot formation, and that can cause young heart attacks. Even when you don't have any risk factors like diabetes or high blood pressure or high cholesterol. That is why the people are now coming in early ages. So other thing, to how to manage stress. So basically, in the initial years, that we used to play a lot. We used to have some hobby. So, but what we get in our emergencies, these are actually IT people, more of corporate fashion of working, actually, what we are getting in our emergencies.
Definitely.
It's not those, any person who is working in government sector, working from 9 to 5 fixed hours and getting time to routinely exercise or do simple activities, simple household chores somebody is doing, he can be free of heart disease. So we are not walking, we are just bound to our chairs, we are static, we are just sitting. And even if we are doing work from home, so we are not exercising. It is just an excuse that we don't have time. What corporates are now doing these days, they have built up a small gym in their offices. So even if those people who are working at night, they actually they mark their attendance for that thing. So it is very important that you at least 15 to 30 minutes of daily simple walking. Just do some shopping for home. So this can make a very large difference in your lifestyle. So that if you exercise, that will take care of your mental stress, or adopt any hobby. If you used to play badminton, anything, chess, board game, anything. So that relieves your stress. Music is actually known to lower your stress levels. Other important thing is that to take care of your diet, like we are used to now for packaged items. These are basically easy going things. We get very easily through apps and through delivery partners. So we have to avoid those things. We have to eat very fresh food. So there was basically a study for Indian continent only. In Southeast Asians, it was seen that lack of fruits, vegetables, and complex carbohydrates, these were the main factors for early heart disease. So we are not eating fruits and vegetables, and especially when we kill our vegetables, we cook them, we basically overcook them. So we have to ensure that our vegetables are not actually burnt. The main important thing, antioxidants, actually they are killed. So these are all the things which basically can take care of our heart.
Definitely. I mean, you correctly pointed out, so when you were listing out things, it looks like it's not a big deal to take out of it. It's just we are so used to making excuses that we tend to be like, this is something hard that I cannot opt for a healthy lifestyle. Living an unhealthy lifestyle is way easier for me and way more convenient for me at this point. But I have to raise this again, because in my generation, we think that, exporting these superfoods that we have nowadays, which are very costly. If you go to a dietitian, and if you have these nutrient foods, these seeds that we talk about, the superfoods, these nutrient seeds that we have to buy, I mean, these are very expensive. Somebody who's, who comes from a middle class background, it's very hard for them to spend so much just so that they can maintain a healthy lifestyle. But how do you create a balance? Is that a myth? And is it possible that just what we eat, the proper staple Indian food that we have, dal, chawal, rice, by eating that, can we also maintain a, heart and, this healthy heart? Dr. Sanjeev, please go ahead.
Ma'am, first thing regarding the diet, it will have to be individualized based on your BMI status. As you age, your BMI decreases, your food has to also decrease. Then you came to the point that these supplements, nutritional supplements. Ma'am, see, most of these nutritional supplements are being sold as vitamins. Ma'am, vitamin by definition is something that is required in minute amounts by the body. So, in a proper middle class family who is not derived of food, which is most of it now, India is now not hungry or starving, you generally do not have a vitamin deficiency unless you develop some disease like tuberculosis or a chronic disease. So, ma'am, these supplements at these costly rates, these vitamin tablets are best left there. You take one fruit, that will probably give you more than what that one tablet will give you. That one tablet you take of 40-50 rupees and that will be out in your urine in the next time you pass it. But a fruit will probably help you. Now coming to the better, easier diets that you need to follow. DASH diet is a diet that is prescribed for hypertensive patients, but it is such a good diet that it's almost good for coronary artery disease also, for diabetes also. So it says you should have 3 to 6 servings of fruits and salads a day. Now, if you look at 3 fruits a day and maybe every meal with a bowl of salad, in a family of 4, it will be probably 1 or 2 kgs of fruits coming every day in the house. I don't think the best houses in India do that.
Definitely, yeah.
So, simply just changing that. I'm not saying you stop with your rice or rotis or dals because still majority of the Indians are vegetarians, so they become the source of protein for them. But yes, don't overdo it. So 3 fruits a day, be it whatever is the seasonal fruit, be it a banana or whatever is available, and every meal with a bowl of salad.
Well, quantity control and quality control is also very important.
And rather than going for these supplement, flax seeds and all that, now we talk about omega-3 fatty acids and their benefits and all this. Ma'am, they truly have benefits on the heart, but when consumed in natural form rather than by supplementing tablets. Now these tablets are hugely costly, but the best source of omega-3 fatty acids are sea fish or this thing. So or there are many vegetables also that do have it. So consuming them will probably help you rather than taking those costly tablets.
Definitely. I mean, you were correctly pointed it out that, you know, it doesn't have to be that expensive. You know, natural is the best way to it. Another important thing that I wanted to raise was that I was looking at some facts and figures, and experts have repeatedly been claiming that COVID-19 really played an important role in this hike of heart attacks and heart-related diseases that we are seeing nowadays. The cases related to, you know, people suffering from cardiac arrest, you know, the general health of a heart deteriorating, and it came after COVID-19. So is COVID-19 really to blame behind this spike in heart attack, Dr. Gaurav?
See, COVID-19 or any factually viral inflammation, viral infection like even influenza virus can lead to heart attacks in people who are prone to heart attacks. So COVID-19 did lead to a spike in deaths related to heart attacks, related to myocarditis, related to heart inflammation, which could have caused you know, rhythm problems. So COVID-19 heart issues are a reality. COVID, I would say, would gradually become an endemic also. And so we have to be careful whenever such viral infections hit us, severe viral infections hit us. We have to be careful. It can precipitate heart issues. Now, something which is preventable, I think, would be with a vaccine easily preventable is influenza. So we should be aware that rather than worrying about COVID, we worry about what is preventable, which is influenza. So people who are prone to heart disease, who are heart patients, diabetics, elderly patients, whatever we used to say about COVID-19 vaccine, should at least opt for the influenza vaccine now. So flu infections or any other viral infections, any severe infection can precipitate heart attack in people who are prone to it. So yes, you should be careful. If you are a diabetic, you are a hypertensive, you have a prior heart disease, then any sort of infection can precipitate heart inflammation and heart attacks. I think COVID is past now. We can move beyond it and not worry about COVID really now. But yes, we should be careful about any other infection which comes our way and protect our hearts, you know, in case we are vulnerable.
Yeah, very well put that, you know, because after COVID-19 and the stress that people went through while in lockdown, I think that can also, you know, can that also be a factor of this increase in heart disease? Because I think stress plays also an important role. It takes a good toll on our heart.
Yeah, definitely. Stress is as has been mentioned, stress is a major risk factor for heart disease. Sometimes sort of overlooked. We talk about diabetes, hypertension, and cholesterol, but those are measurable. They have numbers linked to it. Stress does not have a number linked to it. So yes, we should look at stress. We should play games and have free time. And yes, in case we feel stressed, I think what we lack is a good psychological counseling in our community. People look at it more as a taboo that you have a psychiatric illness. It's not, stress is not psychiatric illness. Stress is, I think, most of us feel stress, but if it goes beyond a certain limit where it starts affecting your health, that people come to me with palpitations, people come to with sweaty palms, they come to me with some odd pains and aches. Mostly young people, and it is mostly related to stress. And what they need is just a bit of counseling and reassurance, and most of them do well. But yes, stress can induce health issues like hypertension. People can get into smoking, they can get into drugs. I mean, that way, then it can harm your health badly.
Yeah, Dr. Sanjay, I would like to throw it to you as well, that he was right now mentioning about stress, and stress is something that as he said, that younger people are coming in, people of who are in their 20s, who are teenagers, they are coming in with stress, that we have stress, we have mental health issues that might and that is affecting they taking a good toll at our heart. So what is your advisory to the younger generation, that because we are talking about, we saw a 14-year-old boy, we saw a 13-year, we are seeing a 12-year-old boy. I mean, what kind of stress is that, because it's important to see that the kind of lifestyle we are living now and the kind of society that we are living in right now. A 12-year-old boy might be feeling, stressed about his life, and then, it resulting in cardiac arrest or, collapsing in school while. So it's disheartening to see. And what is your advice to this younger generation, that how can they look back? They need to really reassess their lifestyle, reassess their stress management situation, and what are the tips and tricks that you can give that for younger generation who are you just going in and out, being busy in their physical activities, socializing with their friends? Why is it important for them to this stress management thing, and how can they build around it?
So basically, stress is not the only factor which causes heart attacks or heart disease. It can precipitate heart attacks or
definitely.
silent heart disease. So you have to manage stress. First of all, don't actually refuse that you have stress. Whenever I see any patient in my OPD, they don't admit that they are under stress. They say, no, I'm okay. So, but it is under a subconscious state, subconscious level, when he is actually having stress. So you have to bring it out. As a good physician, you have to ask him few questions, like a simple stress when you are not having sound sleep. So if you ask that, do you get up many times during your sleep? Are you getting sound sleep? So this is a part of stress. The stress is causing this thing. Irritable behavior, mood changes, then high BP. So even if a patient is thin, he is not smoking, his diet is okay, he's having a lot of fruits, he's walking. But if his BP is high, the lower one especially, the diastolic which we call, if it is high, then it can be because of stress. So first you have to diagnose that a patient is under stress. Stress management is very important, like Dr. Gaurav also said, that you have to actually adapt to some lifestyle, stress-free lifestyle. You should know your relaxation techniques, like music, yoga, meditation. Yoga is known to actually lower your stress levels, and then any type of hobby you can adopt. And a very important thing is that take a break. Okay? Like if you are working, especially in corporate sector, you are working from 8 to 8. There are no hours actually. Even at home, working from home, you are under stress. So take few breaks every 2 hours, 3 hours. Just move around. Go and listen to music, or you can do any activity which you like actually, like gardening initially in the morning hours. So I think stress can be handled very well. And other important thing is, don't actually shy away from getting into a psychologist consultation. Psychology is different, psychiatry is different. So nowadays counselings are available through online counselings are there. So if you are under stress, recognize your stress and take care of that stress in early stages, so that you don't have any precipitation into heart attacks.
I think you put it so beautifully that we need to first accept that I'm having some mental issues. I have stress. I think that is the first step towards a healthy lifestyle. Dr. Sanjeev, my question to you now would be, we were talking about how these things, healthy lifestyle, opting out for making better life choices and everything. But nowadays, especially people of younger generation, we tend to get influenced by what we see on social media, what the influencers, social media influencers or the actors are doing nowadays. And, these more IT hubs on, this corporate, web that we are stuck in. We go around and we have this easily available options of, for instance, if you go to McDonald's, there is this Kartik Aaryan meal nowadays that is trending, and these kind of, obviously they are serving fast food and that is affecting our lifestyle as well. So for younger generation, people who are just out of school, in college, and who are tend to get affected by this, what they are seeing in social media, what their actors are doing, because these are idols for them. So how is it possible? What should they do so that they don't get influenced by it? And in this society that we are living in, where the influence is so high, I mean, you go around, you see every social media influencer promoting, whether it's drinking alcohol, whether it's opting for fast food, whether it's smoking. I mean, how do you keep yourself control? Where do you set your boundaries that no, this is something wrong that I should not be doing, and it is important for my heart. So what is that warning bell that needs to be rang around these young minds so that they start taking care of their health and stop getting influenced by these wrong messages that are being sent around on social media, especially?
As you said, when social media is active, when such incidences of people collapsing come, then you are taken aback. Then you start to think, no, I don't have to do things. I don't want a heart attack. So these kind of messages that come on social media do help everybody at the younger generation to think, reconsider that whether what they are doing is right or wrong. Ma'am, see, at a younger age, I wouldn't say you become a saint or anything. Younger age, you want to try everything, and now you have more options. In our generation, probably we didn't have that much options. So, and probably a generation before had very few options. Now they have many options, so they want to try everything, and that's justified also. So I would just say, do everything, but do everything in limitations. Don't cross those borders. Now those lines are for the person to draw.
Yeah.
You can tell them this is right, this is wrong, alcohol is bad or this thing. But yes, alcohol consumption in India is increasing. And that way, what do you call as a binge drinking, which what causes damage, is having, say, about 180 ml within an hour or so. That is binge. And then that leads to rise in your irregular beating of heart, causes you more damages. Alcohol per se, I wouldn't like anybody to get addicted to an alcohol per se. It is in India that alcohol was a taboo, and then people started to drink. The newer generation, now alcohol consumption has increased. But still it remains a taboo, so it is done probably in a weekend or thing. So what they do, you are having alcohol in 15 days or 20 days or 1 week. But when you're having excess alcohol, that is binge drinking.
Yeah.
That harms you much more than probably a 30 ml drink every day. Unfortunately, in India, you will be labeled as an alcoholic if you're having 30 ml drink every day. And people having finishing a bottle in 15-20 days will probably, they are harmed more by that.
Yeah.
So you have to draw your lines, do everything in life, but in moderation. That is all I would say.
So yeah, definitely exercising control is the key. But I was, reading about some instances, and I was going through some videos that went viral. We have seen people, younger people, they're running on the treadmill, and then they feel sudden, discomfort in their heart, and then they collapse. Then we have seen, a guy who was just dancing around with his family, and then he collapsed. I mean, are the symptoms not clear anymore? What is happening that people are not getting to know that they might be suffering from a cardiac arrest, or, their how do they keep a check on it? Because I think symptoms nowadays, because we have seen people collapsing while doing their normal chores, running on the treadmill, playing football, playing cricket, dancing with your friends. Sometimes just sitting around and you feel some kind of discomfort suddenly and then you collapse. Dr. Gaurav, what is happening? Like, why can't people are able to, recognize these symptoms? I mean, what is this sudden change that people don't understand that, okay, you might be feeling? What are some trigger warnings that they should be aware of? And why is it happening that they don't get to take a look at it beforehand?
See, so this is a very common presentation to us that a young person comes to us if they reach us with a heart attack. And when we go into the history, actually many of them would have had symptoms which are, subtle and they do not recognize it. So a general chest discomfort in the center of the chest when they are walking, which goes away when they relax. Some sweating and ghabrahat, as they say, with shoulder discomfort. Such symptoms and sudden breathlessness, such symptoms can be early warning signs. And especially in people, as I said earlier, who have risk factors for heart disease. So people who are diabetics, cholesterol, hypertensive, smokers especially. So as was mentioned before, that smokers, especially in younger generation, smoking, pre-diabetes and diabetes, these are the major risk factors. So these people need to be aware that they are at risk. So people need to be mindful of their risk factors. So it's very important that these guys are aware. Many of the people who reach us or who have had these events actually have risk factors. If you go into even the celebrities who've had issues, so many of them had heart disease, but they were still running on treadmills. So you have to be mindful. You cannot overdo, as Dr. Sanjay said.
Yeah.
And then there were few celebrities who were chronic smokers. Even on TV, it was seen that. So these people are at risk. It is not that they are young, so they are not at risk.
Yeah.
So even youngsters can have risk factors. As I said, in India, the risk factors come in very early, even in 20s, 30s. I see people who have HbA1c, which is supposed to be, less than 5 or 4.5. They have 5.5, 6. It is not diabetes, it is pre-diabetes, but it is causing inflammation in their hearts. So evaluating those risk factors is important. Health checkups help in that way. After a particular age, every 3 to 5 years, you need to have your blood checked, so that at least you can pick up these early signs. You need to be aware, and then you need to take action. I mean, it is upon you then that you need to take action. Once it happens, you can't blame that, I had a bad lifestyle or somebody had a bad lifestyle. If he was aware, many of these events could have been prevented. Running on the treadmill, and having a heart attack, I mean, sometimes it is overhyped. Not everybody would have it. But yes, if somebody has had a, heart attack while exercising, I mean, you have to see whether, he started exercising suddenly, he should have been slower, whether he actually had all these risk factors. So people have to be, aware. Even if they start exercising, they should do it slowly. And moderation is the key. Playing badminton on a weekend only while you are overweight, smoking, and thinking I'll play 2 or 3 games, and then, doing it after betting is very common in Delhi especially. People love to play badminton. I have scores of patients who are badminton players, unhealthy, playing badminton. And then they lead to heart attacks. So heart attacks in these cases are because of sudden plaque ruptures, where you've had minor early heart disease, but it just gets precipitated by that undue exertion leading to clot formation. So they will come suddenly.
Yeah. Before we wrap this up, I just wanted, I'll go to first Dr. Sanjeev, then we'll go to Dr. Sanjay. What is because parents nowadays are very concerned about, health of their kids, like how can they prevent it? Because symptoms are no longer visible, they are not able to comprehend that you might be at risk. What is the message that you want to give out, especially to parents as well, that how can they keep, a check on their kids' heart and on their, kids' health in general as well, that, so that they don't, suffer cardiac arrest or they don't collapse in school like this. So what is the message that you want to give to the parents especially, and to the younger viewers as well, that how to keep your heart young and healthy?
Ma'am, as I said, we started on this point that the ones that 15-year kid ones, I probably think were not heart attacks, they were cardiomyopathies. These can be diagnosed by a simple history taking, that whether there were sudden deaths in the family before, or just an echo will tell you that the heart is thick or this thing. Then you can have a cardiac MRI based on that. But yes, if there's a history of sudden deaths in the family, then every family member should have at least a basic echo. If you recall the FIFA World Cup, I think the Euro Cup before last time, there was a player who had collapsed on the field, and he had a 30-minute CPR on the field, and the match had to be cancelled. I think it was Sweden or something. So
yes.
these things that they revived him. So he had a cardiomyopathy, and this was not a heart attack. So yes, routine checkups, and if there is a family background of this thing, of sudden deaths in the family, echo will give you a reasonable answer. Now you have genetic tests, with a magnitude of the genetic tests that are coming up. They are not readily available, but yes, in metropolitan cities now they are getting this thing, that they specify more into what kind of a cardiomyopathy you are having. But simple echo is a basic screening test in the family.
Yeah, definitely. Dr. Sanjay, what advice do you have for the parents of younger generation, for the kids who are watching us right now, that what can they do to prevent this situation where we are seeing people collapsing? How can they keep their heart young and healthy?
So basically, parents, they have to watch their kids for few things. One of which is very important is that whether your child is stressed or not. What is happening these days is we are getting more and more competitive. So the coaching start at 7th class standards and 8th class standards. We are making it very harder for them. They don't have any time for playing, for sports. This is one thing that you should give them around 1 to 2 hours of daily sports time. Other thing is that avoid those indoor sports. This is very easy to just buy them some indoor sports, and they are just stick to those TVs and playing, and gadgets especially. So, and other thing is that watch their food, what they are eating. Look at their weight, monitor their weight every 6 months. Look at their BMI. BMI is a simple measure, body mass index. You can actually have an idea whether your child is getting fatty or fat not. If he is getting obese, then this means that he might develop heart disease. He might develop high blood pressure. He can have pre-diabetes, as Dr. Gaurav told us earlier. So basically, we have to watch their routine activity, their lifestyle. So, and they should be aware. They should be made aware. I think every school now, they should have some education on this important topic like heart diseases, why we do get heart diseases. In a study from Delhi kids, school children, it was around 50% of kids between 10 to 15 years of age, they were obese.
Yeah, definitely.
So what is causing? Lack of play, sticking to indoor plays, gadgets, and then only snacky items. Both parents are busy in earning, because we need two incomes now. And what kid is doing, they have been given simple apps, and you can just order and get those packaged items, not fresh food. And we are actually not watching them. We are not giving them good family time actually. That is which is causing us. So this is my message, that just take care of their stress, give them some time, and let them play also.
Well, thank you so much, Dr. Gaurav, Dr. Sanjeev, Dr. Sanjay, for joining me today on the show. And it's important to take care of your health, to look behind your little buddy heart, because it's important that because we are still young people, at kids at 12, a 12-year-old kid, a 15-year-old kid dying from cardiac arrest is not something that we want to see more often. This worrying trend needs to stop. And I had an esteemed panel of media professionals with me today who gave you some insights into what can you do, what you should not do, definitely. And it's time for us to take a step back, reassess the lifestyle that we are living, and make some changes around so that we can live a long and healthy life, and we can keep our heart young and healthy. Thank you so much for joining me on the show. Stay tuned.
With all this gear, you must be wondering if I'm climbing a mountain. Well, let me give you a wider look of this place. This is Asia's largest mountain of shame.
A mountain of waste, almost the height of the Qutub Minar. When you enter capital cities of some of the biggest countries in the world, you don't have 3 garbage mountains waiting to welcome you depending on whichever side of the city you enter from.
The thing is that a lot of times we talk about landfills only when there's a fire at the landfill. You need to understand that a landfill is at fire almost throughout the year. It's only when the firefighters are not able to douse the fire is when it actually catches the nation's attention, the city's attention,